Drainless abdominoplasty is a relatively newer concept that we've introduced to our practice, although it's been around for a little while. It is a procedure in which we perform an abdominoplasty and don't use drains. And the advantage of that, of course, is not having to have drains and not dealing with drains post-operatively and the pain and discomfort associated with that. Unfortunately, not every patient is a candidate for drainless abdominoplasty. Typically, it's going to be your little bit thinner and smaller patients who are better candidates for drainless abdominoplasty. And the way it works basically is that instead of putting drains in, we quilt the skin and fat to the underlying muscle and fascia, and therefore eliminate that space where fluid potentially can accumulate. In our practice, perhaps 20–25% of patients are good candidates for that procedure. If you're not a good candidate for that procedure, then quite frankly, we simply don't recommend that. Now, sometimes we'll combine drains with that quilting technique with the hope that the length of duration of those drains needing to be in place will be shorter. But it's certainly a viable option for those patients who are appropriate candidates.